Hello, and welcome back to the Health Talk podcast. I'm Dr. Bolu. In part 1, we talked about the silent changes that are happening in your body while life is moving on and the numbers many people ignore until complications appear. Today, we're taking that conversation further. We're talking about type 2 diabetes and basic cancer screening. So let's get into it. If you look around your family or workplace, there's a chance you find someone already living with type 2 diabetes or one of its complications. Yet many people do not fully understand what this is. Glucose is your body's primary fuel, and its major source is from the food that you eat. Insulin, a hormone produced by your pancreas, is what opens the door for your cells to absorb and use this glucose. In type 2 diabetes, which is the most common form of diabetes, one of two things happens. Either the body does not produce enough insulin, or it produces insulin but stops responding to it properly. Either way, glucose builds up in the blood instead of being used, and that excess glucose begins to damage the blood vessels, the heart, the nerves, kidneys, and the eyes. So how do you know where your blood sugar actually stands? Here are some basic tests the American Diabetes Association recommends. The first is the fasting blood glucose, and this test is done after an overnight fast of at least 8 hours. Below 100 mg per dl is normal. Between 100 to 125 mg per dl is pre-diabetes, and from 126 mg per dl and above is diabetes. The second test you should know is HbA1c, or glycated hemoglobin. This tells you your average blood sugar over the past 2 to 3 months. Below 5.7% is normal, 5.7 to 6.4% is pre-diabetes, and from 6.5% and above is diabetes. What puts someone at risk for type 2 diabetes? 1. Aging. 2. A positive family history of diabetes. Being overweight, especially if this weight is concentrated around your abdomen, that is, having a large waist circumference. Physical inactivity, smoking, gestational diabetes, which is elevated blood glucose while you were pregnant, a diet heavy in ultra-processed foods, chronic stress, chronic alcohol usage, lack of quality sleep, and certain hormonal disorders like PCOS, which is now known as PMOS, other disorders like Cushing's syndrome, and prolonged use of some medications like steroids. Now, let's spend some moment on prediabetes because it is the warning zone. Prediabetes puts you at higher risk of developing type 2 diabetes. Even certain persons with prediabetes have already started developing problems similar to persons with diabetes. And the truth is, about 8 in 10 people with it do not know they have it. Yet it is the point where lifestyle changes can often restore blood sugar towards a healthier range and prevent or delay progression to full diabetes. So what can you actually do to prevent or delay type 2 diabetes? Research has consistently shown that 1. Losing just 5 to 7% of your body weight can significantly improve how your body responds to insulin if you're obese. 2. Reducing abdominal fat directly reduces insulin resistance. 3. Regular physical activity, even walking, helps your body use insulin more effectively. 4. Increasing your fiber intake through vegetables, legumes, fruits, and whole grains can help steady your blood sugar. Cutting out ultra-processed foods, quitting smoking, managing stress, and prioritizing sleep all make a real difference in your blood sugar. And for persons living with type 2 diabetes, research has shown that sustained lifestyle changes can actually lead to remission in some of them. So if you have been told you are pre-diabetic or even diabetic, please hear this. It is not a life sentence. It can actually be the beginning of a healthier chapter. I want to add this, however, because it really matters. Lifestyle changes are very powerful, but they are not the enemy of medication. For many people, Medication is a wise and necessary part of treatment, depending on the blood sugar level, how long diabetes has been present, and other health factors. Lifestyle and medication are not in competition. They often work best together. So if you're committing to lifestyle changes, bring your doctor along for that journey. Keep your routine reviews. Repeat your blood sugar checks as advised. Good medicine is not a guessing game. It's follow-up, adjustment, and partnership. And for anyone who has never checked their blood sugar at all, let this be your gentle reminder. Do not wait for symptoms. A simple blood sugar test can be done at any hospital or reputable laboratory near you. Now let's talk about cancer screenings. Cancer is one of the most feared words in medicine. It's whispered about, avoided in conversations. Some people refuse to go for screenings simply because they would rather not know. I understand that fear, but I want to offer a different frame today, because here is what fear does not always tell us. Not every cancer is unavoidable, and not every cancer has to be found late. Some cancers can be prevented entirely, and many more can be treated successfully when found early through screening. So instead of only fearing cancer, we need to understand the power of early detection. Let's go through some screenings every adult should know about. And I ask you to pay particular attention if you have a first-degree relative, that is a parent or sibling with any of the cancers we're about to discuss. Because a family history changes your risk profile, and your doctor needs to know that. The first we'll talk about is colorectal cancer or bowel cancer. This affects the colon and the rectum, the lower part of the digestive system. It usually begins as small growths called polyps on the inner lining of the bowel. Most polyps are initially harmless, but over time, some of them can become cancerous. Here is the critical point, and I want you to hold on to it. Polyps can be found and removed during screening before they ever become cancerous. And the recommended screening test is colonoscopy. For an average risk adult, it is recommended you start doing colonoscopy from the age of 45 and repeat this every 10 years. Average risk means you do not have any close or multiple relatives with colon cancer or conditions that can specifically increase your risk of colon cancer, like inflammatory bowel disease. If you, however, have a family history of colon cancer, your screening begins earlier than the general population. And what is recommended is that you start at age 40 or 10 years earlier than the age your youngest first-degree relative was diagnosed, whichever of these comes first. For example, if your parent or sibling was diagnosed at age 40, your screening should begin 10 years earlier, which is at age 30, not age 40. If more than one first-degree relative is affected with colon cancer, your colonoscopy is to start even earlier and occur more frequently than every 10 years. And in some cases, genetic testing may be recommended for you. The second cancer we'll talk about is breast cancer. And there are 3 things I want you to carry with you on this one. The first is self-breast awareness, which is when you know what your breasts normally feel and look like, so that any change is something you actually notice early. This is not about fear. This is about familiarity, because this familiarity can save your life. The second is a clinical breast examination by your doctor. Have that done at least once a year. The third is a mammogram. If you are from the age of 40 to 74, have a mammogram done every 2 years, or it could even be more frequent based on your individual risk. And one very important reminder, finding a lump in your breast does not automatically mean you have cancer, but it should never be ignored. Any breast lump should be properly evaluated by a qualified doctor. And if the lump is removed, it is extremely important that that lump is sent to the lab for a pathology testing to confirm exactly what it is. Unfortunately, there have been people who discard the lump after removal and avoid follow-up out of fear with cancer diagnosis, only to return with cancer complications. Because avoiding diagnosis does not stop the disease, it only delays the opportunity for early treatment, when outcomes are often much better. The third cancer we'll talk about today is cervical cancer. This one deserves particular attention, especially in this part of the world. Cervical cancer is one of the leading causes of cancer deaths among women in Nigeria, and yet it is among the most preventable and most treatable cancers we know of, especially when it is caught early. Almost all cervical cancers is caused by a persistent infection with certain high-risk strains of the human papilloma virus, HPV. This infection causes cellular changes over many years and can progress to cancer. The American Cancer Society recommends that cervical cancer screening begins from the age of 25 in every woman, using the high-risk HPV testing every 5 years, or co-testing, that is the HPV testing with pap smear every 5 years, or just pap smear alone every 3 years. And please also speak to your doctor about the HPV vaccine. It is approved for persons up to the age of 45. The vaccine is one of the most powerful cancer prevention tools we currently have. The fourth cancer we'll talk about is liver cancer. And here are 3 common and preventable causes of liver cancer. The first is hepatitis B and C. These are among the leading causes of liver cancer, so ensure you get screened for them. And if you have not received the hepatitis B vaccine, speak to your doctor about it. If you test positive for hepatitis B or C, that is not the end of the road, because you do need proper follow-up care. Do not ignore a positive result. The second cause of liver cancer is chronic alcohol use. The evidence is now clear. No amount of alcohol is considered safe, so the risk is not reserved for heavy drinkers anymore. The third cause of liver cancer is fatty liver disease, and it has been linked to obesity and diabetes. So if you're overweight or obese or diabetic, protecting your liver is one more powerful reason among many to work towards a healthy weight and a well-controlled blood sugar. Before we close, let's bring everything together. No one should leave this episode unsure of what to do next. What's the first takeaway? Know your numbers. Your blood pressure, your blood glucose, your lipid profile, your BMI, and your waist circumference. These numbers tell a story your body is not going to tell you in symptoms, not until it is much later than it should be. You do not need to be sick to check them. You, however, need to check them so that you do not become sick. Second takeaway is that certain cancers are preventable and many more are survivable when found early. So ensure to screen when the time is right. Ensure to get the necessary vaccinations. Ensure to manage the chronic conditions linked to cancer risk, and maintain a lifestyle that works in your favor, not against it. Get your pap smear done or HPV testing. Book your colonoscopy if you are at the recommended age. Get the hepatitis B vaccine if you have not got it already. And here's your birthday health challenge. I mean this for every single person watching this. Whatever age you are, wherever you are in your health journey, before your next birthday, commit to completing these core checks. Have the conversation with your doctor. Ask the questions you've been putting off. Book the appointment. Take the test. One action taken today or this week is infinitely more powerful than perfect knowledge that never moves. I started part 1 with a statement, and I want to close part 2 with it because it deserves to be said twice. The most expensive treatment you will ever face is the one you needed years ago and did not get. So prevention is not fear. Prevention is love for yourself, your family, and for the life you're still building. Thank you for watching the Health Talk podcast. I remain Dr. Bolu, and I'll see you on the next episode.